Scano, Sago, and hello, everyone. I know it's been a while, but here we are back together. I'm back feeling a little refreshed and ready to get going with the Six Nations COVID-19 podcast for Monday, July the 6th. Now that we've taken care of that, we have to say a big nyawa to Zach Miller, Administrative Director of the Six Nations Family Health Team, for guest hosting the podcast last week. Zach, I owe you one. I hope you did not forget me, but a little introduction on my part. For if you know, or those just joining us, I'm Lori Davis Hill, Director of Health Services and COVID-19 Incident Command of our pandemic response under the state of emergency that remains in place at Six Nations. As I mentioned, I'm here and ready to go. So let's get this podcast moving and see who's waiting for us in our wellness area. Joining us today for my first podcast in July, let's welcome in Crystal Burning, Portfolio Lead and currently managing the Six Nations COVID-19 Assessment Center. Scano, Crystal, I know that you've been busy with the Assessment Center since April, and I'm happy that you could join us today. I'd like to have you share some information about COVID-19 and what we have put in place to support the Six Nations community. First of all, what are the symptoms of COVID-19?
Scano, Lori, thanks. So just to start, the symptoms of COVID-19 have changed as the world learns more about this virus. The symptoms we currently look for at the assessment center are any of the following. We're looking for fever, cough, shortness of breath, sore throat, diarrhea, vomiting, headache, pink eye, loss of taste, loss of smell, or rash in children.
So can you tell me what happens when I call the COVID-19 assessment line?
Yes. When you call the COVID hotline, you'll speak to a nurse who will go through a series of questions with you to gather personal information, things like your name, address, date of birth, OHIP number. We do ask for the OHIP number because it is mandatory. However, you do not need an OHIP card in order to get the testing. We also ask for your current phone number to be able to reach you at. So it's very important that we have that information on hand. After we get that, you'll be asked about any symptoms that you currently have or what has happened that led you to call the assessment center wanting a test. People that are being tested right now are not all symptomatic. Some are calling because they want to visit a loved one in a long-term care facility. So you'll be asked about what your level of risk is to potential exposure through your work or through activities that you have engaged in, and what level of precautions you have taken within those circumstances. So things like whether you were able to keep appropriate distance, did you wear a mask when you were in those situations, did you perform hand hygiene, and those types of things. Once all that information is gathered, the nurse will pass the information along to the physician who is covering the assessment center on that day. The physician will call you back if they have any further questions about your situation or if they have information that they want to share with you. Once that physician assessment is completed, you'll receive a call back from the assessment center to book a time for your drive-through appointment at the test site. For individuals that have mobility issues or for young children, paramedics can go to the home to do the swab rather than requiring the individual to come to the test site. So as you can see from that description, it is very important that we have your current active phone number to reach you at.
It sounds like there's some great communication going on. How do the staff at the assessment center keep themselves and community members safe?
Well, if you are currently having symptoms of COVID-19, when you arrive at the test site, you will be provided with a mask to put on immediately. Staff will be wearing their full protective equipment, which includes gloves, gown, a respirator mask, and a face shield. They will ask you to identify yourself in order to confirm that they have the correct swab with your name on it for the testing. Once your swab is completed, staff have the gown they're wearing wiped clean with disinfectant. They remove their gloves and they put on a new pair in preparation for the next client. This is to prevent any cross-contamination between vehicles.
That sounds very safe. What support is provided to me if I do come to get tested?
Well, when you have symptoms and get tested, you are provided with an information package on things like how to self-isolate, when and how to wear a mask, how to wash your hands and use hand sanitizer, how to disinfect your home, how to care for others, including pets, as well as information on a number of community resources for supports available to you, things like emergency food and housing. You're also provided with a phone number for Shwayken Public Health, as well as a website to check for test results. Public Health will be in contact with you on a daily basis to check in on how you and others in your family are doing, as well as support you to have access to resources you may need. Collectively, we work hard to try and make sure you don't feel like you are on your own in dealing with this illness.
So, will the assessment center be remaining open over the summer?
The assessment center will remain open throughout the summer. We are having test dates on Monday, Wednesday, Friday, and the hotline itself is operating Monday to Friday, 9 till 4:30.
So, what happens if I call on the weekend?
If you call on the weekend, we do have a nurse that is covering um, for after hours support. And what will happen is your call will be answered by Extend Communications, who will then give the information to the nurse that somebody has called. She will call you back and go over the same information that we just talked about. If the situation is one that requires testing more immediately, paramedics can be dispatched to provide testing over the weekend, or we will book you in when the test site is open on the following Monday.
Thank you, Crystal Nyawa, for joining us. It's been a pleasure to talk to you today. Is there anything else you wanted to add before we leave?
No, I think that's everything. Thanks for
Great.
having me.
Great. Try and stay cool, as I know we're in the midst of a heat wave, but we'll have more on that in a bit. So now let's focus our attention to our numbers. Over the weekend, the province recorded 121 cases on the 4th of July, Saturday, and 138 cases on Sunday. I want to provide an update on the current state in Ontario. There are 35,948 total cases of COVID-19. Of those, 31,426 are resolved. There have been a total of 2,689 deaths. So currently, there are 1,833 active cases of COVID-19. Of those, 118 are currently hospitalized. 36 of them are in intensive care unit, and 21 of those 36 are in ICU on a ventilator. Six Nations to date stands at no active cases of COVID-19. We have reported a total of 14 positive cases. Of those positives, 13 have resolved with one death. And in testing, 1,025 people have been tested. 987 are showing negative results. 24 people are still waiting for their results. And 22 people are in self-isolation through the recommendation of Assuring Public Health. Now, in our adjacent communities, Mississaugas of the Credit remains at one resolved case reported. Haldive and Norfolk Public Health Unit has 444 cases. 89 are active. 323 are recovered with 32 deaths. Brant Public Health Unit reports 123 positive cases. One is active. 118 are resolved and 4 deaths. Hamilton Public Health Unit reports 843 cases. 47 are active. 752 are resolved and 44 deaths. And the Toronto Public Health Unit reports 14,611 positive cases. 733 of those are active, 12,773 are resolved, and a total of 1,105 deaths. If you are out and about, whether it be on a patio, shopping in a mall or a store, or getting groceries, please do so responsibly. Adhere to public health guidelines. Monitor yourself and even those around you. Please ensure as that more things get back up and running, COVID-19 does not become an added piece of luggage or baggage that you do not want to unpack at home. And as Crystal said, the COVID-19 hotline remains open. If you have even the mildest or simplest of symptoms, or just a question in your mind, please let us help clear your conscience. You can call the hotline and book your test at 226-446-9909 or toll free at 1-855-977-7737. Now, you often hear from us here on the podcast about the importance of contact tracing. This is a tool that help you and our community so we can track the virus, find out where you might have gotten it, and maybe help prevent someone you know or care for from getting it. Contact tracing is not something that is a negative, and it will never be held against you or meant to cause you undue stress. We often say you can do this with a phone or other electronic device, but you can also work old school. Just get out a pen and paper and keep a daily journal of where you went, who you interacted with on the different days of the week. If you visit Six Nations, please keep us both healthy and moving forward by wearing a mask in public, keep physical distancing, that's 6 feet apart, wash your hands frequently, and clean high-touch areas often. Wear a mask to protect me from you and you from me. You know, the fun part about masks is you could even put this message right on your mask to let everyone know why we should be wearing them in public places where we cannot physical distance. And in closing, please watch Healthy 6NA and Six Nations Matters for online virtual Zoom programming being announced. And if you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204, available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat on Monday to Friday, 8:30 to 4, and that's found on the Six Nations COVID-19.ca website. On the website, you can also find much information about our current response to the virus. Now, we are in the midst of a heat wave, which Zach focused on Friday podcast. The heat wave has not yet been lifted. And here are a few reminders. To reduce your risk of heat-related illness, you can avoid the sun, drink lots of cool liquids, especially water, before you feel thirsty. Thirst is not a reliable measure of dehydration. Reschedule or plan outdoor activities during cooler parts of the day. Wear loose-fitting, light-colored clothing made of breathable fabric. Never leave people or pets in your care inside a parked vehicle or in direct sunlight. Take a break from the heat in cool places, including a tree-shaded area or air-conditioned building, so long as you ensure you are maintaining physical distance from others. Take cool showers or baths. Prepare meals that don't need to be cooked in an oven. Block out the sun by closing curtains or blinds during the day. Shade yourself by wearing a wide-brimmed, breathable hat or using an umbrella. Stay hydrated, drinking plenty of water, and avoid alcoholic beverages and caffeine. Choose cool water and coconut water and the occasional fizzy drink. Eat high water content foods like watermelon, grapes, cucumber, and tomatoes. And if sleeping is unbearable, try a slightly damp towel with you. Use cool or cold foot bath to cool you down. And one more thing, during the summer months, this podcast will be heard exclusively on Mondays. As we move through the summer and into the fall, we will continue to reassess where we are at with the virus and, if need be, increase our broadcast schedule based on the needs of the community. Remember our frontline workers here in Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.